next session today will be a panel discussion on the topic of advancing policy in support of physical, mental, and social well-being, focusing on aspects of policy as it relates to numerous areas of health, healthcare, community health, and the arts in health. The panel will be moderated by Christopher Bailey, and joining Chris are three distinguished panelists. From right to left on your screen, from left to right on your screen, I will introduce them to you now. First, Marcelina Melvin is Deputy Director of the Hackett Center for Mental Health, a part of the Meadows Mental Health Policy Institute based in Dallas, Texas. In this role, Marcy's work has intersected with the American Red Cross, the Child Welfare Services System in Harris County, Texas, the Harris County Juvenile Probation Department, among many, many others. Marcy is a licensed professional counselor who provides child, adolescent, and family clinical services, and she is a graduate of Xavier University of Louisiana and Fisk University in Nashville. In the center, Naj Wyckoff is Vice President of the National Organization for Arts and Health, where he consults regularly on issues of arts and health, healing spaces, arts and trauma, all for health, healthcare, and arts institutions. He is a past president of the Society for the Arts and Healthcare, a past former director of the Healing Arts Program at the C. Everett Koop Institute at the Dartmouth Medical School, and a former director of arts and productions at the Cathedral of St. John the Divine in New York City. And to my right, Nicole Irvin is the director of the Mayor's Office of Cultural Affairs for the City of Houston, where she is the Chief Cultural Policy Advisor to the Mayor and is responsible for implementing the city's arts and cultural plan and for advocating for the creative community and its integral role in Houston's identity, culture, and economy. Nicole is a philanthropic professional with legal, public health, cultural, policy, and international experience, and her career has centered on working to improve the quality of communities and on facilitating long-term sustainable change. She is a graduate of Emory University and Tulane University. Join me again in welcoming our panelists. Thank you all for being here and doing this with us. And I will now turn it over to Chris Bailey in Geneva as moderator to get the discussion started. Chris?
Thank you, Andrew. I'm hoping that this panel discussion will be a true discussion with lots of give and take, but perhaps just to start us off, maybe we can hear from the panelists themselves more concretely about the work that they're doing in arts and health and the policy frame that they're working in as well. And I'd like to begin with Nicole, actually, as she's working with the mayor's office in Houston. And it sounds like a lot of her projects are at the community level. So Nicole, tell us a little bit about your work.
Sure, thank you so much. And first I want to say thank you to the University of Houston for hosting this event and having us here. I'm gonna look at you guys. It has been such an honor and a pleasure to have the role that I do, which is working for the mayor of Houston, Sylvester Turner. And today, he is in DC and just received the United States Mayor's Conference and Americans for the Arts National Arts Leadership Award. And so we're very excited about that, not just for his leadership and vision, but coming into office and seeing the vision that had been laid out that really was integrated into community. And it was a plan for the city that really focused on access, transparency, and equity in thinking about the creatives, the makers, as well as community vitality, community cohesion, and trust. And so this city thinks about art in that way, which I think is so important. My job, my task is to make that a reality. And in large and small ways, we do that principally with our funding and our city policy. And so that includes everything from our green space and how it's designed and how public art is a part of that, which we've seen a renewed engagement in our green spaces in the midst of this pandemic to communities and working toward their economic vitality and arts with the designation of cultural districts. And so Houston has 7 state designated cultural districts. So how do we bring those neighborhood unique characteristics to light in the midst of community, and the importance of sharing and bringing together communities when they are dramatically changing. We also look at this work from our city's art collection. How does the art that the public see reflect themselves? Are we investing in individuals that look like the community, that have experiences from the community? So those are just some of the things that I have the honor to do here in the city of Houston. And I'll end it by saying, listening to the previous panel, and I touched on this briefly with Naj, I think it's so important. As a city, we have the opportunity to fund the arts. We don't typically think first off about research, and our funding can feel very structured. And so we are sometimes in this tunnel and thinking about the arts, or arts and culture, and not necessarily arts and health. And so I think it's so important to figure out how we better partner, how we better communicate with our universities and with others in this work and role. Chris.
Thanks so much, Nicole. Really, really interesting. Now, Marcelina, tell us a little bit about your work in the space and some of the policy considerations or objectives that you've had to work with.
Absolutely, and please call me Marcy and not Marcelina. I still have shock from when I was young. I would hear my mom call me Marcelina, and I'm like, oh, what did I do wrong? Sorry. So I work for a policy institute that really works to inform and influence policy at the state level, particularly for mental health. And during my introduction, you heard that I am child, adolescent, and family trained. And so I'm going to just speak specifically to kind of that child, adolescent, and family policy. During this last legislative session, which was definitely a marathon of a session, right? We were able to be instrumental in getting several initiatives passed. I want to speak to a couple of them, and I'll frame it out as to why this is important. So back in the 86th legislative session, there was a passing of Senate Bill 11, which included a passing for CPAN and TCHAT. So keep in mind, this would have been in 2019. So CPAN stands for Child Psychiatry Access Network. And what it does is, let me put a pin in this and explain that at the Institute, we believe that when we're talking about mental health and mental illness, we believe that it's a pediatric condition because 50% of individuals who exhibit any type of mental health symptoms exhibit them by the age of 14. And 75% of our population will have exhibited those symptoms prior to the age of 21. So we really look at mental health as a pediatric illness. So the CPAN, Child Psychiatry Access Network, really hones in on empowering pediatric primary care physicians on how to identify, diagnose, and treat mild to moderate mental health issues with children and adolescents. And so we do that by partnering them with medical schools across the state. So if a pediatrician has any child that they may be concerned with, instead of just making a referral, they can actually hop on a phone and within 30 minutes have a psychiatrist, a child and adolescent psychiatrist that are kind of like unicorns because they're so rare, but have a child and adolescent psychiatrist who they can consult with on that case. And so by doing this, we're able to build capacity and hopefully be able to catch these, mild to moderate symptoms before they're exacerbated later on in these children's lives when they become adults. The other part of that bill was TCHAT. That's the Texas Access of Health Through Telemedicine. And so with TCHAT, that's in schools across our state. So if a school has any kind of concerns regarding a child as it relates to mental or behavioral health issues, they're able to get that child and their families kind of in an evaluation with a psychiatrist and then hooked up for at least 3 to 4 sessions all through telehealth. So this was in 2019, and in 2019, this was needed because there was a workforce shortage as it relates to mental health. We're in 2022. We're still in the midst of a pandemic. And so what was exciting was that we had those initiatives that started and were in place at the beginning of the pandemic. So when there was this need and this ramp up for children and families to be served, we had telehealth and telemedicine kind of established, and pediatric offices had those resources in place. Well, after this last legislative session, we were able to be instrumental in getting it expanded across the state, in addition to getting funding to support collaborative-based care. So collaborative-based care basically means that mental health and physical health, it's health and it's the same. So it's how do we empower our primary care physicians, we give them the tools and the resources that they need so that when they begin to see or have any kind of behavioral or mental health concerns with their patients, they have resources within their office that Medicaid will reimburse for to be able to connect those individuals to services, which is so critical. And so I mentioned before the pandemic, there was a workforce shortage. During the pandemic, we have now the American Pediatric Association talking about we are now in a mental health crisis with children and adolescents because of the increase in anxiety and depression. We have heard from the CDC telling us that anxiety and depression across the country has increased 3 and 4 times what it was prior to the pandemic. And if any of us were to think about our family members, our friends, or even ourselves, we can understand just how hard going through this collective trauma of the pandemic has been. And so we're now in this space where we really have more individuals that are in need of mental health services and supports than there are providers out there to provide them. And so it really puts us, and which is why I'm super excited to sit on this panel, in a really unique position because we need to be able to expand our concept of the mental health workforce. And we need to really be able to shift and change what we conceive of as mental health treatment, right? We need to be looking at the whole body, mental and physical together. And by us being able to do that, it's like, Erica, when you were talking, you were kind of speaking my language. How do we create communities of healing? How do we create these communities in which individuals day to day that may be struggling with anxiety and depression can then turn to their community, engage in healing activities to help them through the hard times that they're having. So I hope that brought it full circle from the work that we do at the policy level to why it's so relevant and important for today's conversation. Chris?
No, I think it does, and I'd like to underline one point that you made, and that's the relationship between physical and mental health. Mm-hmm. I would go one step further. We have mentioned a few times already the WHO definition of health, including mental, physical, and social well-being. I would argue that sometimes in creating that scope, we have a tendency to talk about those 3 things in isolation as silos, when in fact we know that if you have a physical illness, that might negatively impact your mental health. If you have a mental health issue, your physical life may decline. If you have any of those conditions, your social well-being may become in jeopardy. If in your social situation, you're in a community that doesn't have access to health resources, both physical and mental health may suffer. So thinking about them in terms of not as three silos, but as an interconnected dynamic system, and being able to transform a negative spiral into a positive process and spiral is hopefully something that we can address, and maybe the arts can help on that. Now let's go over to Naj, and Naj, give us a sense of your role with NOAA and the policy considerations and objectives that your organization is working with.
Well, one, I'm so impressed with what my two colleagues just shared with us, and they're so important. And it makes me think of when the very Reverend James Parks Morton first hired me at the Cathedral St. John the Divine. And he told me my job was to uplift the human spirit through the arts. I heard salary, place to park a car, an apartment, health care, studio, things like that. But I very quickly learned the arts can make a profound difference in people's lives, whether it's the homeless, whether it's people at that time who had AIDS. The expression living with AIDS wasn't even a term, with all manner of people from different walks of life. The whole, our place was where the rubber hit the road. And I noticed how interconnected everything was, that the arts can make a difference in somebody's spiritual well-being, their emotional well-being, their physical well-being, their ability to socialize. They're all interconnected. And that, in a sense, is what the National Organization for the Arts and Health is, in many ways, still about. We look at the broad field of arts and health, which includes artists and creative arts therapists and designers and professional artists and all this, working in medical education, medical care, public health, in the design and facilities, and also in all these doctors and nurses and caregivers who use the arts one way or another as part of their bag of tricks. And from a policy standpoint, there's a couple of different things. One of the things we're really concerned about, and which speaks to your needs, is training artists and arts managers how to work within a healthcare environment, public health environment, in a way so they know what their scope of work is, and they know what their scope of practice is and what it's not. And we found that, so we in fact we created a code of ethics and a scope of practice for artists and arts and health professionals as one of our first nationwide, bringing the leaders from all across the country together to do this. And it was very, very helpful. One, it helped people in the creative and expressive arts therapies realize that artists knew what was and was not their scope of practice. They all had that same fundamental level of training in their area. And we're in the process, we just developed a core curriculum. And the goal like this is to help, for instance, this university and others really learn how to train artists and arts administrators so that it leads to accreditation, which is a language that the health industry uses. They want to know that somebody comes in and has a certain core base of knowledge in terms of patient safety and all these other different things, and the interconnectedness, whether it's mental health issues or it's creating opportunities for artists to get jobs. We've also noticed that what is very, very true in healthcare, and has really helped, I think, the public get more aware of lately, is that a lot of people who are living with, COVID, or they are very afraid to go to take certain remedies or go to hospitals. Why? Because often the person who's going to treat them doesn't look like them. We need to have hospital facilities that, like your parks, that are filled with artwork that reflects the sense of place and community. And we also need to get more artists from variety of backgrounds working, because there's a lot of things they can do to help with mental health. It doesn't require, let's say, a therapist, but you can make a profound amount of good. And then they can also, you need them to recognize, aha, I need a therapist. This person needs a therapist. But there's a lot of good artists can do. And because of, see, one of the interesting things is in a hospital setting, a doctor may come in and have really just a few minutes to sort of really get a sense of who you are. And unfortunately, the nurses are so stretched, not a lot more. But an artist comes in and they have time, and they're curious, and they're observing, and they ask you questions. All of a sudden you feel like a person and not like a disease, and they get you going. And of course they need to be trained. If people often will tell them things they may not tell the doctor or nurse, in part because the others aren't there as long. And then the artist immediately knows to take that in, if they hear anything like that, to tell their nurse supervisor or whomever, so that they all build that sense of trust. So that's critical, learning those type of skill sets. But we need to get more people of diverse backgrounds working in healthcare. And there's a lot of talent out there, and they want to get involved. And part of our goal is to help them get that type of training. And you have some tremendous centers, of course, like the University of Florida, and Jill Psaki, good friend. And the university, we believe the University of Houston, with this Texas Medical Center, with the city, with organizations like yours in public health, is really poised to make a profound difference, to really help bring all these elements together. One of the things that NOAA does is every year and a half, we bring together leaders in mental care, in medical education, physical, mental health, all these different areas together. We want to find out what wakes them up in the middle of the night. What are their priorities? What are their concerns? And where we in the arts can make a difference? And what strategic partnerships do we need to address them? You've talked, Chris, about siloing. That is a huge concern in the health industry. We found one of the reasons that leaders in medical care and public health and medical education will come to our meetings because they want to talk to each other. We provide them that forum. And at the same time, they like the fact that we create opportunities of using the arts to make a difference. And they're excited about it. And so I think we're really at a marvelous inflection point. I think our field's going to grow, but it's also going to really grow in a very professional way. And I think I think of the City and Urban and Community Arts Council, what a resource for us helping to reach out and help make a difference in people's lives. And I think in so many different levels. So I'm so glad that the university and the World Health Organization is bringing us together to really talk about practical things, practical policies that we can implement to make a profound difference in the lives of so many people.
Thanks so much, Naj. That's really, really helpful to the conversation. So we have really represented on our panel here the city, state, and national level in terms of policy. I have to say, working at the global level myself, most of the countries that I work with have centralized health systems, whether they're in Latin America, Europe, Africa, Asia. And oftentimes the pathway between research to policy to implementation may be arduous, but it's relatively straightforward. So as an example, there was a pilot project done in the UK on using music to help mothers suffering from postpartum depression. WHO in our European office has sponsored a program where that's being brought to the national level in Denmark and Romania. And if the measures hold up, there's a pathway through the European Parliament to roll it out across the entire European region. In the US, you do not have a centralized health system. And so when we talk about the policy pathways, it becomes a little bit more complicated, doesn't it? You have the Health and Human Services Department of the federal government. You have state departments of health. But you also have insurance companies that set policy for what gets paid for and what doesn't. Can you talk a little bit? Well, let's start with Nicole at the city level. Can you talk about the policy environment at the city level, and how does one navigate that if you want to do the kinds of changes that we're talking about? In this case, using the arts for health for not only personal and community health, but for social change as well.
Carefully. Excuse me. Chris, you've mentioned the federal and state and local, and here in Houston, we're talking about not just the city, but the county as well. And we are a region, so we're also talking about multiple municipalities that are a part of this cohesive community where folks are living and working across lines. And you're talking about a place that has the Texas Medical Center. And when you look at hospitals and insurance companies and those policymakers, the county and the city, so when I think about my role as a city policy advocate for the arts, I am working within departments. So I am talking to our Department of Health and Human Services. I am talking to our county's Department of Health and Human Services, who runs the public hospital. We are thinking about not directly talking to insurance companies, but we are considering what policy language can we put into our funding processes that might make it easier to facilitate opportunities across departments. And so that sounds, or maybe it could sound complicated, and it does not easily translate to the impact for the resident in Community X, but it's necessary work. So having a city that has the capacity and the leadership to want to think about integration of the arts, that wants to be able to look at the work that we do at our Health and Human Services Department around our air quality. And what does air quality look like in communities? How are we monitoring it? How are we expanding education and awareness? And how does the arts play a role in it? So I bring that up because I'm in the midst of right now working with our Department of Health and Human Services, our Office of Government Relations, our Office of Resilience and Sustainability, as well as several environmental health partners and community partners to talk about creative storytelling as it relates to air quality. And so the role that we're doing is bringing those stakeholders together. We are bringing together federal funding and local funding to really be able to support artists, to be able to support community, to have these conversations, to expand their education and awareness. But that's the doing. That's not yet the policy piece of it, the changing. Hopefully, you think about how do you, in a strategic way, ensure that when you're funding the doing, that you're thinking about the planning and the process. So we're looking at what does that mean when community is engaged and educated and aware through these creative storytelling by working with artists. Will they talk to their state legislators? Will they think about the role that they could play when a concrete batch plant is coming into their neighborhood and wants to set up shop? That's when we know that we'll be able to say the city's funding of an artist to creatively work with a community to better understand the impact of their air quality, why they should be monitoring it and aware of, resulting in a better quality of life for their community. And so it's, I think from a city level, it's having the intentionality of working across departments. It is thinking about the funding opportunities that you have in making them a reality.
So Nicole, when you talk about bringing stakeholders to the table, does that include the artists themselves?
It definitely does. You know, I think that there's so many different, when we talk about artists, sometimes I think it's easy to think about them in a singular fashion, right? And so you've got such diversity in the sector, even if we're talking about one specific discipline, right? So if we're talking about visual artists, you have those that have come through the academy, that have the training, that might have an opportunity to take advantage of core curriculum, all right? You have those that are self-taught. You have those that would never see themselves in any way as
Marcy,
a mental health professional or supporter. So yes, definitely we would include artists in that.
So on that note, I want to ask Marcy, when looking at some of the policy challenges you have in the mental health arena at the state level, you mentioned one of the more critical ones is the human resources shortage and being able to bring services to the most number of people. I take it from the subject of this particular conversation that you see artist practitioners as part of the solution. Can you talk to that a little bit?
Absolutely, and actually, after hearing Nicole, you know, there's even more to that story, because just like you were telling and explaining how to leverage the expertise of artists to help communicate and tell a story to a community to increase their awareness. I think about some of the work that we do at the state legislature. So we are, you know, research-based, data-driven, and only kind of promote and push best practices. Best practices that have the research to say that this will give you the outcomes that you expect. And so when we engage with conversations at the legislative level, like we're bringing this data, we are bringing this research to kind of back recommendations or to answer questions that they may have. And, you know, there is a space to figure out how do you translate some of this, like, you know, numbers and bar graphs into a story that legislators can hear, that will make sense, that will resonate with them in order so that we can get those levers pushed in the direction that we want. Because one of the things that I've learned is that legislators are real people, just like your neighbor next door, and they are not experts or knowledgeable on all things. And so it's really important that when we're talking with them about policy changes or wanting to move or shift funding, that it's backed up in a way that's very concrete for them to be able to understand. And so, like, I can definitely see a space there of how do we kind of partner. Just like the previous panel was saying, it was really resonating with me. But then after hearing you talk, Nicole, I can see why. Because it's that, you know, the data, the research, and then how do you use that to tell the story to get the point across that we need to get across. And then, Chris, to answer your question about kind of, you know, workforce, expanding mental health workforce, I think that can be done in a lot of different ways. Whether it's a use of peer support. But at this point, really, you know, I'm focusing on the pandemic that we are all in, right? I keep going back to this collective trauma that is very universal, that everyone has experienced. There is a need to be able to create kind of these healing communities while we begin to come out of this pandemic. There has been so much decisiveness and division that has just been, I don't know if it was exacerbated by the pandemic or not, but it exists. So how do we look at kind of, the arts as a way to be that cohesion or that space where conversations and healing can begin? That's one of the things that excites me about some of this conversation.
Chris, do you mind if
Thanks
I ask
so
a
much.
question?
Naj, you were talking about some of the work that NOAA's been doing in terms of education, certification, the code of ethics. As we all know, when there is a crisis like the pandemic, like the COVID moment that was more than a moment, the COVID several years that we've been going through, artists are often the first to step up to help in the community with compassion. But oftentimes there's an expectation that they work for free and that what they do is a nice thing, but it doesn't seem to be valued at a technical level. Can the work that you're describing, that you're doing with NOAA, help address that problem where is there a policy opportunity to not just see artists as volunteers, but as part of the health workforce whose contributions are valued and paid?
Yes, there's a couple of different strains here. One, I want to go back one step and I'll come back to this, is that I think it's important to recognize we have networks and influencers in our country. John Hopkins, a University of Houston Methodist, a Cleveland Clinic, they do something and a lot of other people go, wow, what an idea. So that's an influencer. So if you can get some of these groups to do something. And another is, like Houston Methodist is not a hospital. It's a whole network of hospitals and clinics. I think of Kaiser Permanente, oh my God, the number of hospitals that they are building and fixing up and running across the country is stunning. And there are these large networks. So one, our opportunity is to get the leadership in these networks to buy into, for instance, if Kaiser Permanente, just to pick one, not to pick on them, said that each one of our hospitals had to have an arts administrator, trained arts administrator, like a Todd Fraser who's following us, wow, what a difference that would make. If we could get, like every medical school in the Houston area, to say, you have to have a credit in arts and humanities to graduate. What a difference that would make, not only in terms of creating work opportunities for artists, but also different than just medical humanities, you'd be having them going to museums and improve observation skills. You might have your medical students doing life drawing while they're working in gross anatomy, and a whole pile of things that they can use in medical education to come out to help them deal with burnout so they don't burn out even in med school, which is a problem, by the way. I think there are things that we can work where you can have an influence. For instance, working with the military has been huge because the military is our largest health network in the country by far. And they've really starting to get into the value of the arts, particularly the creative arts therapies, pre-deployed, deployed, and post-deployed. And that has ramifications going out to a lot of VA medical centers and DoD facilities across the country. So networks can be very powerful tools. And if you can get certain things built in, I think on a very basic level, which goes to your other point, if we can get more hospitals, for instance, like University of Houston is already training people in arts management, and the hospitals are picking up on that. Now, they had a certification degree on top of that. That would make them even more, not only more valuable to hospitals in Houston, but across the country. Because they would say, aha, that means something. And the same is true if we can help artists get a certain level of certification, they will have increased work opportunities in getting paid for it. I'm reminded my old friend Peter Sr. from back in Manchester, England, one of his big visions, and one of his had these 4 different elements, but one of them is that artists get paid, that they become part of the, they get health benefits and everything else, and that's ours too at NOAA, and that's why we created the core curriculum, and we're working to get a accreditation organization set up, and we hope to really start piloting that here. But I really think we need to think of both where you can make a policy change, such as in medical, if every medical school requires just 1 credit in arts and humanities, would make a profound difference. And the same in nursing schools, by the way. And the same thing is we can start getting hospitals that we want to have an accredited arts manager in our hospitals, and if it's a chain of them, like whatever, then that too is going to really grow the field. And at the same time, if we can work with city and state arts councils to help them, train their people to work in these situations, wow. You have to remember that we just saw this tape with Dance for PD going on in Norway. Well, that came out of the Mark Morris Dance Company in New York City, and them starting this PD for Dance program. And it's phenomenal. These are artists who are doing it. These are dancers who are doing this, and they have become very trained and professionalized. They know they're not therapists. They know what they can do and do well. And we need to have really work with more cultural organizations to realize every single cultural organization has a way of which they can make a difference in people's lives this way. And it's good for the artists. In a sense, it helps them. I'll never forget once when I had a major musician come at Dartmouth when I was at the med school, and I wrote into his contract that part of his time he would be performing in the hospital. And when he came to doing these, he said, "Oh no, you can have any med student do that. Any music student do that." And I said, "I can have any med student do an operation on you, right?" "Well, no." And I said, "Well, just as you want the best type of medical care, the patients at the hospital deserve the absolute best type of artistic care." And he got it. So when he went down to perform in the hospital, the first patient said, "No." He said, "Do you think she knows who I am?" I said, "I don't think she cares who you are." And the same with the second. And the third says, "Well, I see you got your violin. I don't know. Do you know how to play Mozart?" So he laid into it. Tears are coming down her eyes. He's having this emotional experience. I had to stop him after 15 minutes and take him to another room. Meanwhile, the first one says, "I changed my mind." He got the value of quality art in a healthcare setting or in a public health setting, whether it's a storyteller, a musician, or dancer like Mark Morris. They can make a profound difference, and we want to help make more people aware of that.
Oh, that's really interesting, Naj. When I look at national expenditures on the arts around the world, it does seem like most countries have a greater percentage of their budget towards the arts than the U.S. traditionally does. If you look at the percentage of the national budget to the NEA and the NEH are slivers compared to other departments of the government. And whenever in the educational system a cut is needed, it's usually arts that are the first to go. And in the past, arguments have been used about the importance of culture for its own sake or to preserve it. More recently, we've had the year of the creative economy, how investment in the arts can have this ancillary economic effect beyond the artists themselves to the hospitality industry, travel industry, et cetera. But now we're entering this conversation about how investment in the arts can actually have a positive effect on the health of individuals and the communities. Do you see either at the city, state, or national level any traction to this argument? Do you see policymakers actually thinking, the evidence is compelling? Do you see movement in that direction?
Yes. And it's based on patient-centered care. Patients like it. And so it's critical for us to measure our outcomes, for us to document that, for us to get it into the various basic ways that we measure patient satisfaction. But patients and families do like it, and we need to, this is why research is important. We need to capture that information so we can bring it to the leadership's attention.
So, Naj, I'm just going to push back just a little bit because I like ice cream.
Yeah, you do.
But it's not good for me, right? Like, I can't eat ice cream 3 times a day. So just because we like something, you know,
That's right.
What does that mean on the actual outcomes of what got that individual in that position? And so I just want to, I'm all about research. I'm all about the data. But I think it's really important that you're able to tie it to the pieces that are going to resonate with those decision makers.
No question.
Because ultimately, the decision makers won't really care if Miss Sally really enjoyed the violin. They will care if, you know, 25% of the individuals who listened to the violin were in their length of stay in the hospital was shorter.
That's right.
That they will care about.
That's right.
So, and then there was one other point. I'm sorry, Chris, but I had like all these thoughts that I had to share. Like, Naj, when you were talking about the certification for artists, I love that idea. And then a part of me gets a little alarmed because, and I'm only bringing this up because initially you were talking about the importance of kind of diversity and for people to be able to see and resonate with art that is meaningful to them and, you know, for there to be this diverse group. And so I want to make sure that we're not continuing and perpetuating inequities that currently exist across our educational landscape because, you know, communities of color may not have the financial means to get certifications, or there may be other inherent biases on the track to getting those certifications that make it difficult or challenging for some communities to be able to access. And so while I love that idea, I really do hope that there's some of those thoughts that you're considering.
Well, let me give you an example of what you're talking about, because you're right. And if I was to put out a call for art for a hospital, the vast majority of it would come from a particular people sort of look like me background. But what we've been doing, the firm I work with, Aesthetics Inc., we really put together a diverse panel from within the hospital, and we also really talked to them about how do we really reach the communities you're talking about. So it took a lot more time and effort on our front to really go out and reach the people who may not have work in galleries and all that stuff. The result is we get a huge increase in diverse art, and not only that, we help the hospitals see that what they traditionally think like is nature on the wall is not necessarily relaxing to a lot of populations. And sometimes an urban setting is far more relaxing. So what happened is a couple things. A lot of more artists of color got work. Two, the artwork in the hospital is far more diverse than it ever was before, and the cost was lower. It cost us more upfront, but at the end, we got such a great return, and the hospital is so gaga excited about it. It's created more opportunity, put more artists to work. So what it means, you're right. If you keep doing things the same way you did before, you're down to failure. It's like when you want to get a certification for people with different backgrounds, well, you make it affordable. You make all sorts of you gotta figure what your goal is. And if you're just playing numbers, that's not going to work. You really got to go out and make that extra effort. I absolutely agree with you. And we are trying very hard to make that happen at NOAA.
I appreciate that intentionality.
Yeah. Well, thank you so much for bringing it up, because that's important.
I was going to say, I appreciate that you brought it up, and I appreciate that you talked about the leadership that's essential for it to happen.
Absolutely.
One of the things that we've seen here in Houston, I mentioned access, transparency, and equity. We've been really intentional in who sits on our panels.
Yes.
Who's making the decisions around where our funding is going? Who's making decisions around the artists that are being commissioned for public art? And that's essential in this space as well. And so that's a role, Chris, that I think cities can play. It's a role that I think local funders can play. It is who's sitting at the table and helping to make the decisions, and the artists.
And in this case, if you take this hospital exec I just mentioned, along with some of the people you're talking about, we need to put them out there talking about it.
Yep.
We need this hospital exec to, I thought this was a crazy idea, but oh my God, did it work. And you're members of your team for the same reason. I mean, part of our job is to get out there and advocate. Oh, yes, Chris.
So one question I have, again, sitting here in Geneva, and particularly during the pandemic when I haven't had a chance to be in the US that much, it does feel like the country is becoming increasingly partisan, increasingly divided on every opinion issue. On this issue of the health benefits of the arts, do you see a partisan divide on this, or has it not yet been affected by that? Does there seem to be more of a consensus emerging regardless of any sort of political affiliation? What's your sense at the city level, Nicole?
My sense of the city level is we still have divisions that aren't necessarily partisan about the arts. And city funding, public funding for the arts. So that is constantly a battle that we fight. And when we began to talk about artists and the arts being a part of health and health care, particularly at a time where health and health care have become partisan, where our data and research seem to not have as large an impact on community and community decision making. So there's some concern on my end that as I am advocating and battling for increased public funding of the arts, ensuring that artists are paid, that while artists are seeing themselves as a part of the solution, and whether that is, this phenomenal project that we heard about in India with the quilts, or a project that we've just recently funded around a fashion show of people bringing cloths from family members that have died because of COVID, and using those cloths to weave together new pieces for a fashion show. So while artists are engaging more in this space of healing, will we see some tension? I don't know, I hope not. So that would be my short answer to that.
I can speak that at the state level, one of the biggest thing is to say what you mean and mean what you say and what you want the outcome to be. And staying away from dog whistle catchphrases and staying out of those hotbed spots that we all know exist, right? You go to a dinner party, there's some things you're just not going to talk about if you're in mixed company and you're not quite sure where everyone is. And so at the end of the day, we want for all Texans to be as healthy as possible. We want for all Texans to be as mentally healthy as possible, knowing that our mind, our body, it's all one, knowing that that means that in order for people to be healthy, we don't live in isolation, we live in communities. We need communities to be healthy. And so I have not come across anyone, including a politician, who has pushed back to say, I disagree with that. And so when we start with a unified outcome, and then let's figure out how do we do this, it's a lot easier to avoid some of the pitfalls.
A key person in our country was Jane Alexander, the former head of the NEA. She made sure that every single assembly person got any funding in their district, no matter where they were. They could have been in Barrow, Alaska, or southern in the Keys in Florida, or the middle of any other state or whatever in the country. And that was critical. And she wanted to make sure that every single member of the Congress could get up and make an announcement about how this organization or this whatever in his or her district got funding. And that was really such important work and such an important foundation that collectively we've all tried to grow. As I mentioned, my Congresswoman Stefanik, who is the third most powerful Congresswoman now in the House, and she's what can I say? She's a mixed bag of what her policies are, but nobody has been more supportive of the arts. And she's been a real champion in our organizations. We've met with her, and she's been right there. And so she's a conservative Republican, and the other people are advocating for the arts are liberal or conservative Democrats, and the same within the House. And so far, they've really stood tall in terms of supporting arts and health across the country. I mean, the arts across the country, and I know with Americans for the Arts are trying to get a big increase, which has long been needed. But the city of Berlin, I think, puts more money into the arts than the entire United States. So yes, you're right on that score. We have a ways to go.
Well, hopefully, with any luck, who knows, maybe Arts and Health can work its magic and bring all disputing parties together as one happy family. It's certainly something to be wished for. We have run out of time, and I would like to thank all of you for a stimulating and wonderful conversation. And thank you so much. I've really been enlightened and ennobled by it. And I would encourage our audience to stay for the next exciting session that is coming up right now. So thank you very much.
Thank you.
Thank you.
Thank you.
Chris, thank you, and thank you to the panelists. We will take a 5-minute intermission while we make a transition to the next session.